My name is Denise Thomson. I'm based in Alberta, Canada. I'm one of the co-directors, the three co-directors of the Cochrane Planetary Health Thematic group. And so this morning I'll be giving you just a quick overview of the Planetary Health Thematic group and what we're doing. We're a relatively new group, so we're very excited to be part of Cochrane now. So if you're not aware, Cochrane recently introduced its first 5-year scientific strategy. This strategy will this year into 2030, and it has 4 pillars: maternal, newborn, and child health, multiple chronic conditions, infectious diseases and pandemics, and then lastly, climate change and sustainability, which is the one I will be talking to you about this morning. So why climate change and sustainability? It's for some people a relatively new concept, change as a health issue, but climate change is actually the major health threat of our time. And it affects human health and health systems in a wide range of ways. I won't get into the full picture. That would be a talk in and of itself. But to take just one example of climate change impacts, it involves rising global temperatures, which in turn can through intensification of the frequency and duration and seasonality of extreme weather events such as heat, wildfires, storms, and floods. And as well, it contributes to the spread of vector-borne diseases. So health systems have to respond to these changing and worsening health impacts, but also health systems themselves have to attend to their own role in contributing to the because health systems themselves are major carbon emitters and producers of plastic waste. And estimates vary anywhere from 4 to 8% of global greenhouse gas emissions are caused by are linked, to health systems. And so because of that, we believe that Cochrane has a really important role to play in setting global standards for climate and health evidence synthesis. So our group grew out of the Climate Health Working Group, which was established in 2020, initially as an ad hoc group of people preparing a submission to the Toronto Colloquium. There was supposed to be a colloquium in Toronto in 2020, which got canceled. But after that, we decided we wanted to keep going and keep working together. The establishment of the working group showed that there is a lot of passion and concern in Cochrane around issues of climate change and planetary health. And we wanted to build on that enthusiasm and passion. So in 2024, Maria Inti Metzendorf, Miranda Kumpston, and I applied to form the Planetary Health Thematic Group. And that was approved in September 2024, just over a year ago. We have a network of over 200 members. So we have researchers, staff at stakeholder organizations, at non-governmental organizations, as well as consumers. And we have links with many organizations in this space. We're members of the Planetary Health Alliance. We have links with the Campbell Climate Solutions Group, as well as the Collaboration for Environmental Evidence. We're building linkages with the World Health Organization, from the UK NHS, as well as the UK Health Security Agency and the Public Health Agency of Canada. So our priorities are fourfold. We believe it's extremely important to develop rigorous methods for climate health evidence syntheses. It's important to evaluate the risk factors and interventions to inform and improve climate resilience levels individually as well as systemically. We're focused on supporting review production by identifying priorities and topics for synthesis, as well as supporting author teams. And we're hoping to assess public health strategies to cut emissions and pollution and highlight the health co-benefits of those strategies. They'll briefly tell you about some of the work that will. So there's been a couple of proposals accepted recently. Heat as a prognostic factor for the development and progression of diabetes. And I'll talk to you a little bit more about that one because it's really fascinating methodologically. As well, access to urban green spaces and health outcomes among marginalized populations relates to planetary health, although we're not the primary managers of it. As well, we have submitted working on a protocol for the thermal stability and storage of adrenaline, and that is related to planetary health because of intensifying heat, that which has knock-on effects for being able to safely transport and store medication, such as adrenaline. So I'll talk to you about prognosis review, heat as a prognostic factor for the development and progression of diabetes, which is going to be a systematic review and meta-analysis. And this covers all types of diabetes, type 1, type 2, and gestational diabetes. It's currently underway. It's funded from a research grant from the German Diabetes Foundation. The proposal was submitted earlier this year, and the protocol came out about 6 months later. An extensive author team, and so this has been a great opportunity for the first author, who's a first-time Cochrane Review author, to receive support from people with a lot of experience. And as well, the screening is now bringing in people from Cochrane's mentoring network. So there's a really important capacity building piece to this review that I think is really fantastic. To dive into its aims, you may be wondering, planetary health and prognostic factors align. So this is a great example of that. Its aim is to synthesize the currently available evidence in order to understand the impact of heat on diabetes incidence, as well as the impact of heat on the progression of diabetes-related complications and the health-related quality of life and mortality in people living with diabetes. And so this is a really policy-relevant review. It will help inform evidence-based prevention and treatment guidelines. And of course, the goal of all of this work, as it should be, is to improve outcomes for people living with diabetes. And so, of course, all Cochrane reviews have that goal of improving outcomes for people. But in this case, we're talking specifically about improving outcomes for people living with diabetes in the context of a changing climate and the planetary health aspect into this work. We're also doing some methods work. So Richard Webster and I have been leading some work for the UK Office of National Statistics. This is a 3-year project that the ONS is running, which was funded by Wellcome. You're seeing here our first publication, Climate Change and Global Health Outcome Indicators, which was a scoping review that extracted 73 unique indicators and 33 repeated ones from 20 sources. And the purpose of this, to identify globally defined indicators of climate change impacts, can help to inform the design of official statistics. And official statistics are one of those sort of quiet backbones of global policy making. Outside the space, you don't think about, and when you're inside the space, you realize how important that is for harmonizing global decision making. We're also just wrapping up our second scoping review for this project, which was on mental health outcomes relating to climate-sensitive extreme weather events. You may have heard about the Wellcome-funded consortium DESTINY, which is an acronym for Digital Evidence Synthesis Tool Innovation for Yielding Improvements in Climate and Health. Very ambitious project. And our co-director, Dr. Maria Inti-Metzendorf, is working closely on this with the team. As well, our Australian co-director, Miranda Cumpston, is leading a mapping review on priorities for interventions in health and climate. with the aim of identifying established priority for climate and health interventions by both governmental and non-governmental organizations. So that's a few of our work. We'd love to talk to you more about what we're doing. You can reach us at cochrane.planetary@gmail.com if you'd like to be added to our newsletter. So we send out newsletters as needed, so not very often, only every 3 or 4 months or so. So you're not signing up for a lot of spam if you get in touch with us, but we use the opportunity to know about recent publications, upcoming events such as this webinar, and other items that we think will be of interest to the group. As well, if you have review topics in mind and would like support or ideas, please get in touch with us and we'll do our best. We're also working on setting up opportunities for collaborating with other people, connecting with other people for that collaborative work. A lot of people who join our group are coming in with a great deal of and really want to get stuck in on a project. And so we're working on infrastructure for helping you to connect people to make that happen. So if you sign up for our newsletter, you'll find out about that work as it develops. All right. On that note, I will wrap up and turn things over to Thomas to talk to you about GRADE Planetary Health.
Hello, everyone. Thank you so much, Denise. Fantastic to hear about the work that you're up to, that Cochrane is really pioneering and supporting, and that I think is really well aligned. It's exciting to have the opportunity to speak with the webinar group here today, and seeing in the chat there's people from really all around the world joining, and hopefully those that weren't able to make it can catch it online as well. My name's Thomas Piggott. I'm a first and foremost a public health doctor, and I'm also a researcher that focuses on guideline development methodology. I'm at McMaster University in Canada. Here's my declarations of interest. So importantly, no financial COIs to report. Some of the work in the presentation has been supported by a government agency, the Public Health Agency of Canada, for one of the guidelines that I'm going to discuss. I'm a member of the GRADE working group, and certainly intellectually have a personal interest, vested interest, perhaps intellectual conflict with improving planetary health and also the guidelines that address it. So it's also great to see a number of familiar names on the call, folks that have been part of all of these conversations and that are part of this work. And it really has been a very collaborative group and journey so far. We started the GRADE for Planetary Health project group in January of 2023. 2022. So we're 2023. So we're coming up on 3 years this January. And it really has expanded into a large global group, nearly 100 people on our listserv joining our monthly meetings. At the end, if you're interested, there's a QR code for how to sign up to the project group mail list, and we'd be happy to have people. It's a very open group and discussion approach. So what am I talking about today? Well, planetary health and how evidence synthesis, in particular guidelines, can consider it. When we think about planetary health, I'm of the circle over here in the public health realm. Many of us in the probably Cochrane community deal with one of these first couple of circles, with individual patient care, interactions, interventions, with more human population interventions. Some may even deal with more global human interventions. There may be some vets or some ecologists in the audience that start to think more about non-human animals, other species, and conceptually referred to as One Health. Planetary health expands and includes the natural geophysical Earth systems that we depend upon. So it's not just the climate, though we have a lot of attention and concern about the climate emergency. It's broadly all of the Earth's natural systems and the life, human and non-human animals, that depends upon it. To kind of contextualize this conversation, I find it helpful to paint a picture of development globally, human development globally in the last couple of hundred years. And the Lancet 2015 Commission on Planetary Health did a great job of this. So these figures are from that. What we've seen globally, unequally, I should add, very unequally, but still globally on average, is an improvement in life expectancy, an improvement in health, decrease in poverty, decrease in child mortality over a multiple decades, multiple centuries um, uh, context. At the same time, this has been linked to improvements in material wealth and extraction, and this has negative impacts on the Earth's geophysical systems. So we've seen CO2 emissions, energy use, deforestation, water use, fertilizer use, ocean assist, all of these variables, the stressor points on the Earth system start to increase as well. So we have seen improvements in health, tremendous improvements and progress in health at the cost of the health of the planet. And as the Planetary Health Check says and shared this year, our planet's vital signs are flashing red. We've now breached 7 of the 9 planetary boundaries. What do I mean by planetary boundaries? More on that soon, but it's the multiple Earth system boundaries, the natural geophysical systems that life depends upon. And we're at a critical junction, that's for sure. In 2025, so the work updated in November, we've now transgressed or surpassed the safe operating space of 7 of 9 boundaries. One of them we had transgressed. Quiz into the chat, which of the ones that we had transgressed several decades ago, and we made progress and put it back within safe operating space. Any guesses? Guesses into the chat, which one that might have been? We made tremendous progress thanks to global united action as a result of the Montreal Protocol and work against CFCs, and several people guess right. Thanks, ozone layer, into the chat. So we have actually, humans have had significant negative impact, but they've also demonstrated we can come together, we can solve these problems. When we talk about the safe operating space, it's this donut, and this is sometimes illustrated as the donut economics theory or donut Earth system theory, between a social foundation, again, a reminder, again, unfortunately, the resource extraction and development has led to huge health improvements, right? We don't want to say people can't use energy. We don't want to say people can't use food, access food, use water. The challenge is the surpassing what is necessary for a healthy social foundation and just breaking through an ecological ceiling. And this has been a very rapid progression over the last couple of decades alone, from 3 boundaries crossed in 2009 to 7 in 2025. We're really at a crossroads, both on climate and other planetary boundaries, and the decisions we're making now will secure or not a livable future, and we have the ability, we've done it before, to address these issues. We're not seeing great progress in that. Unfortunately, COP30 saw significant interference, no participation of I'm in Canada, neighbors to the south, but also countries like Canada that, have, I think, historically, recent history contributed significantly to global climate talks, actually possibly contributing to derailing that work and that progress. And so this is concerning. Seemingly high-income countries have, quote unquote, here seen the Guardian article, lost enthusiasm for tackling the climate crisis. But unfortunately, the climate doesn't care whether we do. It's not everyone, it's not everywhere. Many countries are pressing ahead with a ambitious climate agenda, and that is in spite of the loss of interest and will from some of the biggest emitters. Let's zoom into health. Certainly the history of Cochrane and Archie Cochrane, an interest in making sure that interventions we use are based on the best evidence in health and that we do no harm. We make sure that we use interventions that contribute to health improvements. So I think the foundational value that we started the project group within GRADE upon was that we should be thinking about health guidelines and how they also can do no harm or net contribute to benefit, including not only to human health, but to the planetary context. And this is impacting patients, right? This isn't just about guidelines and interventions we assess. We're already seeing, as Denise talked about, downstream impacts of the climate crisis on heat-related illness, respiratory disease, infectious disease transmission, malnourishment. This is all here today, not tomorrow, not decades from now, and it's getting worse rapidly. The healthcare sector itself probably contributes to between 5 and 10% of global emissions. So it is not the most perhaps important sector, thinking about food consumption, thinking about energy production and use in transport, in buildings, in industry are larger pieces of the quote unquote pie chart. But healthcare is something close and proximal to us. And as we think about guideline decisions, we can truly influence it. It isn't just at a disposal or end of life and reducing waste standpoint. It's through every phase of what is called a life cycle, from raw material extraction to processing, manufacturing, assembly, use, and ultimately disposal. There are impacts on carbon emissions and the other planetary boundaries across. Um, this is a visualization looking at primary care and healthcare, and some of the key sectors, and the area graph here demonstrating, well, where in primary care at least some of the most important contributors are. We've had lots of conversation about meter dose inhalers, and that is an important intervention to look at, but there's a lot of other pharmaceuticals to consider, other procurement related pieces. And this is just in primary care. Access to primary care globally critical. Tertiary, secondary, tertiary care, more hospital-based care, probably much larger energy consumption and footprint. It isn't only about reducing emissions. I think this work by Jody Sherman, Andrea McNeil et al. Is really illustrative to say there's also appropriateness of services. So making sure that we don't inappropriately use treatments, whether that's overprescribing of antibiotics or unnecessary medical imaging. A lot of Cochrane's work in health looks at the evidence behind interventions and whether there's a contribution to benefit. Matching supply to demand, reducing inappropriate healthcare is important, but also, and I'm a public health doctor, so this is probably my favorite space to be in, we can reduce demand for health services by focusing more upstream on some of the social determinants of health and some of the prevention related interventions, whether they be vaccination or health promotion campaigns or work on the healthy built environment, all areas that are important in addition to just reducing emissions. The Canadian Choosing Wisely has developed a climate-related agenda and a number of recommendations. And again, this links to Choosing Wisely recommendations center on appropriateness of care and reducing inappropriate care. Same here with climate negative interventions. And you can see some of the recommendations. So coming to guidelines and really the work of GRADE, the work necessitates leadership. And Maria Enti, who's on the call, and colleagues have led this work to Ayrton, I see on the call as well, I should say. Lots of great colleagues and collaborators, part of the GRADE project group, have led this work to say, first of all, that decision-making bodies should be thinking about planetary health. They must show leadership. How can they do that? Well, through a number of activities. And this work from earlier this year identified some of the strategies. So employing life cycle assessments on interventions, engaging diverse experts, providing training, considering healthcare sustainability, and considering environmental impacts in the primary research. One of the key ways in a guideline realm is actually to consider the impact on planetary boundaries in a multi-decision criteria framework for decision making, and I'll come back to that shortly. We wrote this earlier last year. And this was identifying some of the barriers to addressing planetary health. We have a new scoping review that'll be published soon. It's been accepted. Um, and it looked at the all of the literature from a scoping review perspective on guidelines and HTAs that considered planetary health. We found only 4, despite the plethora of guidelines and literature out there. Really important that more start to consider it. Why aren't more guidelines considering? Well, I think there's a lack of a will to address. There's certainly a lack of methods, and this is some of what we've tried to advance in the methods that we've proposed for considering planetary health and health guidelines, and you'll see more on that shortly. Expertise and resources, some of the weighting considerations. What do we do when something's good for human health but has a negative planetary boundary effect? What are the planetary health inequity considerations? And equity is critical because, again, health improvements over the last couple of centuries have been unequal, but also the highest emitting countries, the countries contributing most importantly to negative impacts, are some of the countries least affected. The countries in contributing the least are some of the most affected by severe weather events, warming, other planetary health crises challenges. There's educational opportunities certainly too, as we try to strive to get more guidelines to think about this. So our project group considered a number of hypothetical guidelines. And what we did was we simply broke down prioritized boundaries, being boundaries transgressed, and looked at the evidence around the planetary health consequences. So this was a guideline using an existing guideline, but creating a fictitious panel and conversation around decreasing red meat in a diet. And this was found to, we proposed, have a large desirable climate impact, a moderate desirable impact on freshwater land use. And so you can read more about this case study, including a full evidence to decision framework in the forthcoming GRADE guidance on planetary health. Ultimately, we realized, as compared to the original guideline, which indicated there wasn't a need to change diets based on consumption of red meat, looking more from an individual human health perspective, we found when considering planetary health, there may have been a different recommendation, a recommendation against continued red meat consumption. Another example, this coming from the Canadian post-COVID condition guidelines. Cochrane's certainly been in the space, lots of research and work through the COVID-19 pandemic. We looked at the impact of face masks for COVID transmission. We found a benefit. The balance of benefits and harms favored masking is the judgment the panel made. And we wanted to look at what the impact on planetary boundaries were. So certainly the guideline panel felt at a climate change and pollution standpoint, especially thinking about microplastics and disposal degradation of face masks, there were undesirable effects of face masks, but still the benefits and harms favored, and ultimately the judgment recommendation in this guideline, which is available online, canpcc.ca. You can click on the recommendations tab and look at the guideline itself. Still favored masking. But there was really important dialogue about the planetary health effects, and also then in implementation of the recommendation, how to minimize through perhaps procurement, packaging, materials used, negative planetary health impacts of face masks. We actually also compared in this guideline different kinds of face masks, medical masks, disposable respirators, and reusable respirators, and found a total CO2 emission and ultimately impacts across the life cycle of each of these. So you can really break down different interventions and find this. This was using a star-based system just from 1 to 5 stars. There are different ways that guideline panels could do this. As of now, we have an ETD judgment that we've proposed on planetary boundaries, which I'll come to later. Looking at this, we could also model, and colleagues from University of Porto have looked at this in the area guideline and looking at asthma treatments. We could model the trade-offs between carbon emissions and the health benefits, just like we do for cost effectiveness analyses. So there are multiple ways and modeling strategies that could be deployed. So ultimately, our group earlier this year in May saw the approval of over 2 years of work towards GRADE for planetary health guidance. The guidance is broken down into 7 components and has been submitted for publication. The categories are addressing planetary health and health guidelines, the scope, expertise, consideration and PICO question, inclusion of evidence, consideration in the evidence to decision framework, and ultimately implementation and research considerations. So it anchors on a guideline process. First of all, we say public health or health system guidelines should formally address planetary health. Um, Clinical ones also should, but if it is not, there at least should be a justification for why planetary health considerations were not included. At a scope level, we suggest scoping out potential impacts and prioritizing planetary boundaries that are transgressed and relevant to a guideline topic. We suggest inclusion of planetary health expertise, and we note the diversity of that expertise. Climate experts are not biodiversity experts, are not experts in nitrogen phosphorus flows. There are many different hats that people wear in the space, and having the right ones is important. PICO question formulation and prioritization. So within the discussion on which questions the guideline is going to look at, we should think about the impacts across different populations, interventions, comparators, outcomes, and that we should be thinking in particular about areas where there's co-benefits, because if there is a benefit to the climate and to human health, that might be a prioritized area. So, for example, active transportation, which brings health benefits of physical activity and planetary benefits of decreased carbon emissions. Inclusion of evidence, we suggest systematic reviews to identify evidence, which could be direct measurement studies, modeling studies, including LCA. There's one type of modeling study that's quite popular, and also qualitative evidence. And we noted in particular around impacts on the environment and health, traditional indigenous ecological knowledge may be very relevant to decisions. In the evidence to decision framework, if you're not familiar with the ETD, it's a multi-decision framework that many guidelines use that looks at the benefits and harms of interventions, but also the certainty, values, costs, cost effectiveness, equity, acceptability, feasibility, those kinds of dimensions. Planetary boundaries be added as a 13th criteria, and this has now actually been operationalized in one of the software solutions for guidelines. And that panels make a judgment across each boundary and then a summative judgment for the planetary health effects from large desirable to large undesirable. And that ultimately this go into recognizing it's not the only criteria, but it's an important one. It go into the ultimate health decision making. Finally, implementation and research considerations. What strategies can be taken to mitigate harmful effects of the intervention and recommendation? What adaptations considerations are necessary? Denise talked about a couple of good examples, and what research priorities can be made around planetary health. And so that is the guidance that we've developed. I will be happy to take any questions or comments. There is a sign up here that I'll come back to in the moment, but just a plug on a personal level that I think it's so much harder to disregard the health of the planet when we are not connected to it. Here's me and my kiddos out in nature and enjoying it. I think when we can get out personally in nature, connect with the natural environment around us, it makes it a lot more obvious what we have to lose and what we have to take care of. So that's just my plug, whether it's go out for a hike, go out, hug a tree, spend some time in nature. I think it's important for us all, and a bit of a personal plug at the end. References included here. And again, sign up sheet for the GRADE for Planetary Health project group here, and we'll be happy to take any questions or discussion. Really appreciate the opportunity to present and be here today. Thank you.
That's great. Thank you. Thank you so much, Thomas and Denise. That was fascinating stuff and lots of interesting information there. Thank you. We haven't got any questions in the chat just as yet. But maybe while people are thinking, I had a question. So you talked at the beginning about kind of that the political will for kind of tackling the climate crisis seems to have kind of dipped over, over recent years. And I wondered, I guess, why you thought that was, and if there's anything that kind of ordinary people could do to kind of push it back up the agenda.
Do you want to go first, Denise, or?
Yeah, I don't have any brilliant insights. I'll just contribute my perspective from Canada. Our new Prime Minister, Mark Carney, used to be the governor of the Bank of England, and when he was in that role, spoke so much about the importance of addressing climate change. And so when he wound up as our Prime Minister, I was so excited, and I felt so disappointed by he just a series of actions in a year or so which have really undermined climate progress. And so it's been discouraging to see somebody who clearly knows the importance of addressing climate change and yet is clearly constrained either by politics or, well, by politics, I guess, from actually doing that. Canada, of course, is very preoccupied right now with periodic threats from our neighbors to the south that we're going to be annexed forcibly or otherwise. So I guess those more pressing issues of national sovereignty maybe trump the longer term issues of preserving health and life on the planet. But it's discouraging to see that we can't do both at once. Anyway, I suspect that's the case worldwide as well. It's just that so many crises like scaring us in the face right now. It's hard to think long term. But Thomas, what do you think?
Oh, that's great. I mean, I totally agree, Denise. And it's really hard right now if you're in this space to see some of the decisions happening. I think I'm coming from a Canadian context, very Western, higher income country setting context, um, and I know that that is not actually the case all around the world. Many countries continue to politically prioritize this. So I'll start with that. I think I think a few things. One is uh, one is around evidence and the importance of evidence. One is around a false dichotomy that's being created, and the last is around hope. So I'll take each of those quickly in turn. On evidence, and I think for this community, I think it is very easy when we do a poor job of clearly and simply articulating evidence and findings for maleficent actors to prevail. And the fossil fuel industry, because let's be real, the majority of what we're talking about when it comes to planetary health crises and at least CO2 emissions is our continued human reliance on fossil fuels as an energy source and the need to transition away. Fossil fuel companies have a huge corporate interest. There's a huge and sometimes very insidious movement affront to try to undermine evidence, to sow uncertainty where it doesn't exist, and to counter the work that people in the health and the climate space are doing to promote public understanding. So that's all the more reason to get more clear and articulate and compelling in our advocacy. I think Cochrane has done a great job of that with a lot of knowledge mobilization, plain language work. I think all of that is critical at this juncture. So evidence. Second, on the false dichotomy, I think one of the challenges we have is we've set up this, we're at a crossroads. We need to act today. We need to act now. And I worry that that undermines and creates a false dichotomy of an issue that is a continuum. The longer and the less we do over the next number of decades, the less livable the world becomes, the more problems health have. And I think if we continue to sort of, I don't know if it's playing chicken or trying to play a bit of a game of bluff and say, we need to act today, we need to act now, and present this as a false dichotomy, we start to polarize people into two camps of reality. One is an understanding that we need to do things now, but the other, and increasingly and spread by misinformation and certainly large corporations, media, and social media companies, is a world and ecosystem of complete disbelief that climate change is real and climate change and action on planetary health is important. And the last thing, which I think ties in, is some hope. I mean, for me, I sometimes feel quite negative, quite unhopeful about some of the decisions being made. But then I go out and I get in my canoe or I go for a hike and I spend some time in nature and it's all reignited. And I think, especially for younger people, I'm kind of among that group, but not as much as I used to be. We need to instill a possibility of hope and action on these issues, because if we don't, then the response to hopelessness is acceptance and inaction. So, albeit challenging, albeit intimidating, I think it's on all of us to instill a sense of hope, joy, positivity, and optimism around action and improvements.
Great, thank you. Sounds like we need to celebrate successes then, maybe a little more. Great, thank you. Okay, so we've got a question from Yasmin, and also I think Maria Inti wants to ask a question. If we take Yasmin's question first, and then Ollie, could you unmute Maria Inti? I can't seem to do it. But if we take Yasmin's question first, so do you think guideline development can be applied to planetary health as of now? Maybe an explanation of development, if I'm saying that right as well, would be helpful.
You want me to take that one, Denise? And maybe if you want to add on use of evidence across multiple domains. So adolament, or the contracted word in the GRADE community of adoption, adaption, or de novo development of guidance, is the notion that we should not just reinvent the wheel and duplicate the work of others, but rather use, credit, and contextualize work, because there may be different considerations in different settings. I think for sure, I think the problem is there's not a lot of primary evidence, primary guidelines still. So we need to build that. We need to build the primary evidence base, modeling studies, systematic reviews. There's a whole ecosystem of evidence that's needed. But increasingly, as it starts to get there, that's great. And I think one of the things that we've heard in our work is guideline panels are busy, challenging endeavors. There's a lot to think about. You're doing a review on the benefits and the harms, and you want to get that right. That's the table stakes for any guideline. But you also want to consider costs and resources and equity and these other dimensions that we know are important to decision making, planetary health now among them. However, I think with that large set of considerations comes a lot of work, which can be challenging, costly, intimidating. So the more we can collaborate and the more we can share this work, we've started conversations in the project group around synergy across decision-making bodies. There's a paper that I'll put into the chat that we'd written on this more broadly, the ecosystem of health decision-making, led by Professor Holger Schoenemann, around how we should all be working together. HTAs, guidelines, evidence-informed policymaking, the different paradigms of health evidence should be working together to share evidence, to have united common messaging on decisions. And so I think there's a lot of opportunities, and I really look forward to that emerging. We're doing some work on mapping planetary health evidence now, and I hope into the future we'll be able to share some more about that, and it'll be more accessible to people that want to take these considerations in mind. Thanks. I don't know, Denise, did you want to speak about the elements of like collaboration and certainly you've created also within the systematic review community, great networks and collaboration.
Yeah. So one thing that comes to mind is we've had within the three co-directors for the Planetary Health Thematic group, we've had lots of conversations, methods and methods development, and to what extent new methods are required for this for planetary health evidence syntheses versus being able to extend, say, the methods that have been developed over years for public health reviews, for example, which already are in place for very complex questions. So, Thomas mentioned earlier the importance of interdisciplinary work, and I can't underscore that enough. I've seen some, what I would consider maybe a little weak evidence syntheses, not in Cochrane, obviously, but outside of Cochrane on planetary health topics with groups that are health folks, but haven't brought in meteorology experts or climate science experts or so on. And, they just, it's not where, the people in health just need to start reaching out in a more interdisciplinary way and realizing the need to be bringing in a much broader skill set than a typical drug A versus drug B review would require. And that's hard. We don't necessarily know the people. Interdisciplinary work is always challenging. It's hard to find common language and so on. But very important. And our colleagues at the Campbell Climate Solutions Group are really showing how that work can be done. So some great role modeling there to learn from. So I guess that's the first thing that comes to mind is, methods. There definitely do need to be some new methods developed, and we're trying to chip away at that. But also the importance of just, I'm speaking to a health community crowd here. You just understand what you don't know. Even basic things like being able to differentiate between climate change, climate, and weather. A really fundamental point, but I've seen some evidence syntheses coming out that purport to be on climate change, but are really on weather. And if you're, if you're a decision maker in the space, that differentiation really matters. Are you planning for weather or are you planning for climate change? Those are different things. So anyway, I'll leave it at that. Because I really want to hear what Marie Enti has to say. So over to you, Maria Enti.
Thank you. Yeah. So, Denise, thanks for introducing our group. And my question is a bit more related to what Thomas explained about the GRADE guidance that is coming out. And we just had a meeting with the GRADE Planetary Health group as well. So I think people who are interested in the space of planetary health can be overwhelmed by the whole Earth system that comes at us and the different planetary thresholds that are transgressed. So Miranda is conducting a prioritization exercise on how to prioritize all the different questions that we have to ask. But we also spoke about this during the GRADE meeting. And I was wondering, Thomas, if you could expand a bit about our discussions, how to prioritize. You already said the planetary thresholds are important, but how about the impacts? How about the own leverage that you have? And this can be related to influencing primary research, but of course also conducting evidence synthesis and incorporating it into guidelines.
Yeah, no, that's great. Great point, Marianti. And I think it was a really interesting discussion, and I think requires some more collaboration and iterative thinking about how and what we prioritize, because I think there's been a lot of energy expended on some topics. There's some very classic topics now in health that have been discussed a lot. Desflurane versus sevoflurane as an example in anesthesia, but not to single out specific topics. There are topics that get attention, and they're not always those that are driving the largest negative contribution to planetary boundaries. So transgress planetary boundaries, like you say, important. The absolute effect, important. We've had lots of conversations, and Cochrane knows this well, relative versus absolute effect, and thinking absolute in a global sense, or at least in a properly contextualized sense, whether that be a region, country, I think is important, because if we see a large relative effect that has a small absolute effect, it is a lot less important. But the magnitude of the effect, probably not the only driver. The potential feasibility. If there's something that's an easy switch, it's cheaper, it's lower CO2 emissions, it's politically feasible to implement. It improves equity, like thinking across multiple criteria. If it is easier, it may be beneficial. We've had a lot of conversation in the group about co-benefits, where there is synergistic benefits on human health and planetary health. That's important to consider as well. So I think we're continuing these conversations about what the criteria or approach could be to help to prioritize topics for guidelines. And yeah, happy to hear more from others, and looking forward to continuing the collaborative work with you, Marie and T, Denise, others in this space to figure out ways that we can help to support guideline developers in navigating these questions and the work, because I think, again, it's tremendously important, timely. There's certainly an appetite. One thing I didn't mention, the scoping review that we did that had only 4 guidelines, well, nearly all of them were within the last 2 years. And there's an exponential increase in attention, and the search date of that review that should be published soon is almost a couple years old now. We know in the intervening time, there's been a lot more guidelines starting to consider this. So it's mounting, the interest in energy is mounting, which is great. But we need to continue to support that momentum forward.